Good afternoon, dear patients. Today we will discuss a case of throat gonorrhea and candidiasis, basically in the oral cavity. A man of non-traditional orientation came to us who often engages in anal oral contacts, and his partner in fact complained about new discharges from the penis. He also sent his passive partner for tests. Accordingly, he was examined and swabs were taken, including from the mouth. During the examination, we noticed that there was whitening of the tongue, a kind of white coating, and redness of the throat. So they were, in general, not very pronounced, not intense. However, the patient did indeed experience some swallowing difficulties and mild throat pain. These complaints were genuinely bothering him. Accordingly, tests were taken for all infections that can live in the mouth, chlamydia, gonorrhea, HPV, and so on. However, gonococcus and candida albicans were directly detected. Accordingly, treatment for these conditions was carried out, including topical therapy, injections, and pills. So the treatment duration was 10 days, and both antifungal therapy, enzymes, and antibiotics were used. After that, there was a 3-week break. Follow-up tests were taken. The follow-up tests were negative. What is worth emphasizing here once again? The point is that if a person uses not only their genitals for sexual contact, but also their mouth or anus, I always ask or try to ask about this when taking samples or during appointments. You should not overlook, in fact, the possibility, and it is absolutely necessary, to take swabs from the anus and mouth to determine if these areas are affected.